Good afternoon, dear patients. Today we will discuss a case of HPV type 33 in a man. In principle, I wouldn't say that this type is fundamentally different from others. However, I would like to cover all HPV types because when patients discover a particular type, they tend to consider it something special and look for information specifically about it. So, specifically, men who came to us had small condylomas at the base of the penis. It is believed that small condylomas are characteristic of HPV type 33. A large number of them is typical. Sometimes the literature says that such condylomas are characterized by a wider base and narrowing towards the top. However, this is by no means an absolute sign. But as a matter of fact, there are absolutely no significant or fundamental differences to be found here. When we look closer, we can see that this is indeed the case for the specific classification known as type 33. The virus of types 6 and 11 belongs to the group of alpha viruses. Condylomas with type 33 occur much less frequently than with types 6 and 11. However, in principle, it is the same kind of virus that strongly stimulates the division of cells in the urogenital organs. As a result of their uncontrolled division, condylomas are formed. When we examine types 6 and 11, we see that noticeably smaller and more subtle projections are frequently observed as a typical characteristic, whereas for type 33, it is important to note that this specific feature is considerably less pronounced and much more difficult to distinguish. It is important to note that indeed, the condylomas are quite small in size and are typically found in numerous clusters. Otherwise, there are no other particularly significant or noteworthy differences to mention. Furthermore, it is confirmed that yes, type 33 belongs specifically to the group of viruses that carry an exceptionally high degree of oncological risk for the patient. However, the risk remains. This risk may not manifest in youth, but depends on the time since infection, the state of the immune system, and the concentration of the virus. Naturally, this patient was tested for 20 types of human papillomavirus with concentration measured. In this case, the concentration of type 33 virus was 10 to the 6th power, which is considered a high concentration. Accordingly, the condylomas were removed using a laser. Furthermore, of course, the use of condoms played a role here, because once again we see condylomas at the base of the penis. Most often, this specifically points to condom use because the condom, that ring at the base, is, of course, it rubs against the base of the penis and it makes it easier for the human papillomavirus to penetrate there, which, although it can pass through a condom, as is considered in medicine, the concentration that gets through is extremely low. That's why the base of the penis is a classic site for genital warts, including in this particular case. The condylomas were removed. This year, an immunogram and a complete blood count were performed, after which immunological treatment was prescribed. 3 courses of immunological treatment were carried out. Currently, testing for human papillomavirus type 33 shows it is not detected. The observation period for such a patient is still about 4 months, so it is not possible to speak of a 100% cure for human papillomavirus yet. However, overall, the results achieved are quite good. There are good results in the treatment of this virus. What can be said here? It is highly recommended and strongly advisable that you do not delay consulting with a qualified medical professional, because the greater the amount of time that passes since the initial infection, the significantly more complex and difficult it often becomes to successfully achieve a complete and lasting cure. However, it is still possible in any case.